As an aspiring nurse, the NCLEX is the final hurdle you need to jump before you can start your career. And just like any big final exam, students tend to walk into the testing centers practically their britches. Well, the best solution for NCLEX anxiety is not benzos. Actually, it's preparation. It's walking into the exam knowing the content and having practiced enough NCLEX-style questions to actually write your own. The question is, how long should you take to study so that you meet this criteria? Well, the answer depends on whether this is the first time you're taking the NCLEX or you're a repeat test taker. Either way, you'll find the answers you're looking for in this video. Hi, I'm Thea Beckman, a learning coach with Brainscape, the world's smartest study and flashcard app. If you haven't yet discovered our certified NCLEX flashcards, go check them out today because they will help you memorize the essential facts twice as efficiently as any other study technique, which will help you prep quicker and feel more confident going into the exam. Also, make sure you subscribe to this channel for a steady stream of really helpful tips on doing well on the NCLEX and getting started on your nursing career. Right, let's get started with how long you should study for the NCLEX if you're a first-time test taker. If you're fresh out of nursing school and all that knowledge is still crisp and clear in your mind, you should give yourself between 2 to 6 weeks. During this time, you'll be doing a massive content review of everything you've learned, as well as a lot of practice questions, so that you're ready for the specific challenge of the NCLEX, which heavily tests critical thinking and reasoning skills. Oh, and here's an important tip. Don't wait longer than 3 months after your final nursing school exams to take the NCLEX. I know you're tired and probably desperate for a break, but the longer you wait, the more that content will fade from your memory. You do not want to have to start studying from scratch when you finally decide you're ready. Okay, so what if this isn't your first rodeo? How long should you study if you're a repeat test taker? Well, the average is 2 to 3 months, but in reality, it can take you anywhere from 6 weeks to 6 months to adequately prepare to take the NCLEX again. 6 weeks if your content knowledge is essentially strong and you have the time for daily study, review, and questions practice. But 6 months if your content knowledge is weak and you don't have a lot of time for daily studying, like, if you have a family to look after, for example. Either way, you can pass the NCLEX, even if you failed several times already. But you need to give yourself enough time. Don't be in a rush to get it over with. You are far more likely to pass, and pass well, if you take your time with your prep. Now let's turn our attention to daily expectations. How long should you spend studying every day? Our recommendation is that you devote a solid 2 hours per day to studying and questions practice. If you're a full-time student and have full free days every week, then you could do even more than that, which will get you through all your prep quicker. Just remember that anything more than 5 or 6 hours of studying can be an inefficient way to spend your time, since your brain can only retain so much new information every day. Now, if, on the other hand, you don't even have 2 hours per day, try for at least 1 hour. It'll take you longer to get to the finish line, but it's way better to devote a little time every day than to cram 10 hours into a single day. You'll progress quicker and stay motivated if you break up your studying into manageable daily goals. Now, speaking of efficiency, here's a super nifty study tool you can use to whip through the mountain of content tested by the NCLEX twice as efficiently as any study technique you may be using. I'm talking, of course, about Brainscape certified NCLEX flashcards. We've worked closely with a panel of experienced NCLEX educators and tutors to break down the latest NCSBN curricula and test plans for the registered nurse and practical nurse exams into 2 collections of 3,000 flashcards, which cover the most important facts you need to know to answer the questions you'll see on the final exams. These smart flashcards are then organized into decks like management of care, pharmacology, and maternity. By prioritizing only the most essential information and drilling you on it via a spaced repetition algorithm that is personalized to your pace of learning, the app is engineered to help you learn twice as fast as any other study technique you might be using. Also, let's not forget how simple Brainscape is to use. You can use it anytime, anywhere on any device to study, even just for a few minutes at a time, while you're waiting for the bus, on the bus, between classes, on the treadmill. Anytime you have a few minutes to spare, take out your device and instead of trolling those socials, get in some quality study time. You'll find those short study sessions quickly add up. So there's everything you need to know about how long it should take you to study for the NCLEX. 2 to 6 weeks if you're a first-time test taker and that content knowledge is fresh for you. 2 to 3 months if you're a repeat taker, although it could be as much as 6 months if your content knowledge is weak and you can only spare an hour per day to study. And don't forget to study for at least 2 hours per day if you can, but no more than 5, otherwise your brain just won't retain that information. For even more guidance on this topic, check out our full guide in the Nursing Academy, where you'll discover many other free guides and all kinds of related questions like how to study for the NCLEX more efficiently and how to overcome exam stress. You'll find the link to these articles in the show notes below. Also, don't forget to like and subscribe to this channel, please, for a steady stream of really helpful advice on all things nursing and NCLEX. Finally, remember, focus on achieving your daily study goals, look after yourself, and lean on Brainscape. If you do these things, you can and you will rise to the challenge of a career in nursing.